Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Now, today I'm excited to have Dr. Jennifer Davis from Healthy Living with Dr. Jen, and we're going to explore how she cares for her patients with her practice being grounded by science, rooted in joy, and changing lives with wellness care. Now, before we jump into this episode, just a quick message from our sponsor, Grow Solutions, where we believe brilliant healthcare professionals shouldn't have to choose between patient care and practice growth. We handle the business side so you can focus on what you do best. In Grow Solutions, we eliminate some of the biggest headaches, whether it's new patient or client lead generation. If there's some communication issues that are taking place, we put systems in place for that. There's always operational chaos that people have, so we've got proven systems and frameworks to help. And yes, we do help you implement AI because it's coming whether you want it or not. Why not utilize it to make it easier in your job? So we're not an agency or a vendor. We are a growth partner. So if you've ever thought or said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. So just drop the word grow in below or send me a message and I'll get back to you if I can. However, today, you're here to meet our superstar guest, and that's Dr. Davis. And I want to welcome you to the Prime Health Podcast, Dr. Davis. So please do tell us a little bit about yourself and what you do.
Thank you so much for having me. I'm really excited to be here. So I am a pediatrician, pediatric intensive care trained, and lifestyle medicine trained. And I have been practicing medicine for almost 30 years. Practiced mostly as an intensive care physician for many years, and then became really disillusioned because many children were showing up with adult type illnesses, and that's how I transitioned into lifestyle medicine. I found this amazing specialty where I was able to help people reverse disease. So basically that's what I do now is I help coach children and adults and anybody that wants to get to the root cause and ideally avoid medication or back down on medication if they're on medication already, or prevent, disease for the future. And that's what my practice is focused on, basically.
Yeah. I love that we talked earlier, how you were in, pediatric intensive care, and it's we had our son in neonatal intensive care, and I don't think people understand. I've had a couple of guests on that deal with how people burn out in practice and dealing with kids. I'm sure you've had some horrific experiences along with joyful experiences as well, but it's a very difficult profession that you're in, and that realization that you had was that I don't like how kids are appearing to be more sick for reasons that they don't have to be. And I think that that's great that you're making that change.
Yeah. Practicing pediatrics is amazing. It's a gift. I mean, it really is. We see the best of the best, So it is disappointing that children are being affected more and more by these types of diseases. But the great thing is that children are very resilient. And so being able to give them the tools to provide health for the long term is really, where the power is. So I'm excited about it.
So maybe back before you even jumped in, was there a moment in your life that you experienced or you realized you said, I'm going to go into a career in medicine?
Truthfully, my father died when I was very, very young. So I think, from that time, I think throughout my life, I always had this desire to understand the human body. I loved science. That's what everybody always says when they go into medicine, but I did love science. And I think even the spending time with my pediatrician, like, and seeing, that relationship over time and, whatever he shared with me. I mean, I was very impressionable, with what he taught me and what I learned. And then it just stayed with me, from the time I was 7 years old, I had decided that's what I wanted to do. And I just, continued down that path. So. Yeah.
So even at 7 years old, you realized that you wanted to do that because of your pediatrician. So when you were in medical school, you didn't have any shift away from that, thinking orthopedics or anything else. You're like, it's going to be pediatrics.
Truthfully, I will tell you that when I was in medical school, the first rotation I did was surgery, and I did fall in love. So
Mm.
I did actually, I did a year of surgery,
Oh,
but I enjoyed the surgery. I enjoyed the critical care part of it. I didn't really enjoy so much the adult medicine part of it. So the part I was interested in pediatric surgery, but I realized that I would spend years and years in training with adults, in order to be a pediatric surgeon, and I wasn't really it didn't really appeal to me. So I decided I wanted to do pediatric intensive care. Actually, when I was doing the surgery, I really enjoyed the ICU. I loved the physiology. I loved the procedures. I loved being able to help see people, recover from these things, these really, scary situations. And so that's what I decided to do. Yeah.
I love it. And it takes a different type of physician to deal with pediatrics in that nature. So from somebody that's had to deal with doctors when our son was, little, I appreciate what you do more than most people can imagine, because it's very important. And the beauty of pediatrics is not only do you help the patient, but you help the parent. You kind of get a 2-for-1, or I guess maybe it's a 2-for-3, however that would be, because you're really making a change in the family when you're affecting the kids, which is great. So you made that decision that, hey, I don't like what's happening in pediatrics. So how would you explain to people the difference in lifestyle medicine versus what they get in traditional medical care?
So in lifestyle medicine, I mean, technically it would be traditional medical care, but we don't in the current medical system, the modern medical system, we don't spend the time doing these things. So really, lifestyle medicine focuses on 6 pillars, and I add a seventh I like to talk about. But 6 pillars is nutrition, so plant forward nutrition, exercise, sleep, mindfulness or stress reduction, connection, human connection, because we're social beings, so that's really important, and avoidance of toxins and risky substances. And so those are the 6 pillars. And then I'd like to include joy, because joy is essential. And that often comes out of the discussion when you're talking about illness and health. We always, we seem to be, it's hard. We need the science, but we tend to be very rigid and we move it away from the human part of it. And I think that's so
Mhm.
critical when you're talking about employing these pillars. So
Yeah.
that's basically lifestyle medicine.
Do you see people locally to where you're at? Is your practice more of a virtual style practice?
It is. It's a telehealth practice. So I see, technically, I do medical care for New York and Vermont, but I do coaching nationwide, actually worldwide. So I have a coaching program that's focused on reversing diabetes. And
Okay.
so that is, for anybody can do that.
Mhm.
So.
Okay. And also in your patient slash clients, you will take children on as far as clients, and then adults, grandparents, kind of a situation as age demographic.
Absolutely. Yeah. So, when you talk about children, really it's the family, right? Because a child is not making a lifestyle decision on their own. And that's kind of how I got to doing this lifestyle medicine, because when you're talking about making a lifestyle change, it really involves the whole family. And so, yes, I do. I will treat children, but really it is you're treating the family, which is most of pediatrics, right? When you think about it, it's mostly treating the family. So.
Yeah. So your pillar number 7, I think, is critical to what you do. It's about the joys, So how or why is that rooted in your practice so strongly?
Well, I will say, I'll give you a little bit. When I first did this journey, I became plant-based first. I became plant-based about 15 years ago. And I found out about whole food plant-based nutrition and about the power that that had to reverse disease. But I was finding that it was very rigid, and it was hard to sometimes stick to that rigidity. So trying to find where I can enjoy. I love to cook. I love to eat. And I think that's really important, right? That's what we do multiple times over the course of the day as humans. We need it to sustain us. And so there should be joy involved. And so that's kind of how I've progressed over the years to really. So when you talk about joy, you should fully enjoy life. And I think part of what's missing is we're rushing through life and we're not really living in the current moment. We're always looking forward. And that leads to many things, chronic diseases, anxiety, depression, many things. But also just fully enjoying food. When we're rushing through our food, we tend to not pay attention to satiety. So that's one thing.
Mm.
Um, Joy is also essential when you're trying to make a lifestyle change. If you're not enjoying it, if you're feeling like I'm always doing something wrong, or, it requires rigidity and discipline, it really makes it hard to maintain. So having joy as essential, right, when you're making these changes and supporting these changes is critical.
Yeah.
And we know joy is connected to longevity and health as well. So it really, when you look at it all the way around, I think it's essential. I think it's one of the primary things that I like to work with my patients on. When I first meet them, that's the first thing I talk about. So.
Really? So that's interesting. So tell me how that first conversation goes. If you're leaning into the joy, like how does that get approached? If somebody says, I've got type 2 diabetes, and you say, I understand that, let's step back a little bit. Let's talk about joy in your life. Is like, tell me how that works.
Well, when I do the initial intake, I should say, when you do a lifestyle medicine intake, when I first meet the patient, usually, it's like a 90-minute visit, and we go over every detail of their life, how they eat, whether they cook, what foods they enjoy, and what they enjoy to do, what things are causing problems. And really by going through that whole detailed history, then we start with, I do a little bit of education about whatever it is their particular problem is. If you're talking about diabetes, I talk about, the connection between what they eat and the lifestyle and the connection. But then before, making like normally you would write a prescription, say. With this approach, it's more collaborative. So looking at those things, looking at what the ultimate goal is, but also looking at what's important to them and what brings
Mhm.
them joy and incorporating that in that plan and decision. So I always talk about food. So I'll say, often when somebody comes to me, I particularly work with a lot of women in midlife, and they've gone through many diets over their lifetime, and they've struggled, and often they feel like they're always doing something wrong. They feel like maybe they haven't been heard, because it's always that same recommendation, eat less, move more, and it doesn't take into account, or sometimes they've been told to avoid the foods that they've grown up with. Like
Mhm.
I work with many international clients, and sometimes it's the traditional foods that they've been told, well, that's not good for you. And I don't think that there's any food that's, you know, off limits, right? It's a matter of how your pattern of eating and the overall picture. And so just working with my clients to find that joy in whatever it is that they love to do, what they love in their life, and making sure that it's part of the plan.
Yeah.
So.
I from the joy perspective, I know I'm leaning into this so heavily, and I
Mhm.
apologize for that, but it's just interesting to me. How does the pillar of mindset and joy, how do they work with one another?
Well, mindset, when you think about trying to make a change, and often lifestyle change is hard. I mean, I'm not going to say that it's easy, because usually these are patterns that you've had for your whole life. And when we go down the traditional, prescriptive route, rigid route, you have to do this, you tend to reject it, right? So even though that that's what's recommended, your your mindset is you're always going to avoid pain, right? That's just what we do. We don't want to be in pain. So
Yeah.
I think having a mindset of, I like to look at it as a mindset of abundance as opposed to restriction, looking at what you can include, what you can, instead of looking at always feeling like you're doing something wrong or that you have to follow a rigid rule, opening it up and really having it be a mindset of progress, not perfection, number one, and that there's room for abundance, as opposed to restriction. And I think that people tell me, in fact, my last group just started, last week, and it's actually been 2 weeks in. And one of the things we talked about is everybody's like, oh my gosh, I feel like a weight has been lifted, and that they're making these choices and not feeling, that feeling of always, having to do something, or always feeling like it's just they're happier, and they feel like it's easier, I guess, to make the decision and stick with the plan when
Yeah.
it's open that way.
I love it. From what you're doing, working from shifting in traditional medicine to now lifestyle medicine, what do you feel are some of the biggest misconceptions that people have about lifestyle medicine?
The biggest thing I will say, people think that lifestyle doesn't work or that it's too hard to do or maintain. And I hear that from my colleagues, unfortunately. They'll say, "Oh, well, forget it. My patient can't do it, or they won't do it, or they refuse to do it." And I think part of it is that mindset, but it's also, it takes time.
Hmm.
So when we're measuring it against numbers and we're measuring it against traditional medications, then sometimes we don't see the results that we're looking for as quickly. And so that part, I think, is a big, misconception that it's not working when
Okay.
it's working. It's working in other ways, and it takes a while to see the outcome that you're looking for. So, which is
Yeah.
another thing I work with my patients. It's like, look at, not just the number, right? Think about how you're feeling.
Hmm.
Look at the wins, look at what you've done, look at the changes you've made, and lean into that. And that's really, important.
Yeah. It's a process when they going into a traditional setting and getting a prescription is a process in itself. But seeking lifestyle medicine, making positive changes that we would love to see in 30 days, whether we see it in the mirror, we feel it in our body, whatever, but it is a process that you go through. So there are expectations that they have, and I'm sure you have to work with them on what their expectations are.
Right. It's coming up with different expectations and really looking at, one of the things I talk about with them is like, why are you doing this? And what is your ultimate goal? If it's just, a number, then sometimes that's hard. It's like really digging deeper and figuring out what else is important to you and what the long-term goal is. And that's an important shift. Because,
Mhm.
you talk about lifestyle. Yeah, you look at one number, but lifestyle affects so many different things, right? So maybe your goal is to lose weight, but in the process, you lower inflammation, you improve your energy, you decrease your risk of heart disease and dementia later on. It just goes on. And then working with women and families is like you create a ripple effect. So now
Yeah.
this change, this medication only works for you, but this lifestyle change, it goes on.
Yeah.
It's really powerful. So,
Yeah, I was absolutely going to say that when you get a pill, and I don't mean to be so negative towards a
sure.
prescription, but when you get a pill, it is really only for you. Maybe it has a tremendous positive effect, and yes, it can have that butterfly effect on the family. But when you are working on them with lifestyle, and they just see and feel those small incremental changes that eventually get bigger, not only does it affect them, but it's in a positive way. It's affecting the family around it. So it's such a true point on what you bring in up to that. Um, yeah. So, uh, in your practice, what type of conditions do you commonly see?
I guess the most common is diabetes. That's my focus because I feel like that I do seek out.
Okay.
Um, but also I see people that want to lose weight. Although that's, I like to look again not just at the number but the whole picture.
Hmm.
And people with heart disease, that have either had, a diagnosis or just have high cholesterol and they want to avoid that in the
Hmm.
future. But really, it applies to everything. I mean, I've seen some children with autism, that are trying to optimize the families, trying to optimize their diet or, their behavior by using different lifestyle matters. Asthma. I have a few patients with asthma, so just really applies to everything.
Yeah.
But the bulk of my patients are really diabetes,
All right. And
pre-diabetes,
then
diabetes. Mhm.
will you have younger children that are the pre-diabetic as well that you'll see?
I don't have any right now. I have one that I have a consult with next week, but
Okay.
mostly women in middle age. A few.
Okay.
Mhm.
So have you noticed just in general across the board that there is more of a need for patients seeking out lifestyle medicine?
Is there is a need. I think it's always a matter of education because I don't think it's mainstream. I mean, even among my colleagues. So really a lot of it is education. Um,
Okay.
there definitely is a need because when you talk about type 2 diabetes and pre-diabetes, it's
Hmm.
reversible with
Yeah.
lifestyle. And I think not a lot of people understand how that works, what the physiology is behind that, but also what our choices impact,
Hmm.
health.
Yeah. And you had said, Dr. Davis, that you do some plant-based. Well, like that's because of a lifestyle change that you personally made. And then is that a suggestion you give? It doesn't have to be an ultimatum, I would assume, of the patients that you give them choices.
Absolutely. Yes, I work with them. It's really about the quality of the diet and definitely more plant forward is better, but no foods are off limits. Like I said, I try not to, you know, make a prescription where, you can't have anything. But I just really focus on adding more plants and just improving the quality of the diet overall. And it's funny because eventually, I have had patients that have become plant-based, even though I haven't said, you have to be plant-based. It's just by learning, empower and also seeing how they feel, with the
Mhm.
changes.
Yeah. Interesting. And so no food is off limits, not even Twinkies.
Not even Twinkies.
Not even Twinkies.
Not
Okay. I
even
might have to have a
Twinkies.
consultation with you. We'll see what happens.
I mean, I'm not saying the Twinkies are the main part of the diet, but yes, no food is off limits.
All right. All right. Um,
I
from a business
usually don't
perspective,
say Twinkies, I say Oreos because Oreos are vegan, but I don't know about Twinkies.
I like that. I like it. Either way, they're both pretty good once in a while. Once in a great while, I
Right.
should say, not too often. From the business perspective, Dr. Davis, what are you focusing on right now to grow your practice?
Really, I use a lot of social media. So I am on YouTube. I've been building my YouTube channel recently. So that's growing nicely, and I feel like I get a lot of interaction, good questions on YouTube. And then I'm on all the platforms. I mean, I'm everywhere. And then I do some local events and things like that. I do Walk with a Doc, which is that international organization. It was actually founded by a cardiologist, David Sagbier, and it was founded to encourage his patients to exercise more. So it's now an international organization. So I do have a local chapter here in Bennington, in Vermont. So
Okay.
I do that.
And explain more. So you meet with a group of people and then you go
Mhm.
for a walk and a talk.
Exactly. That's
I
exactly
love
it. Yeah. We talk about a different health topic and then we go for a nice walk.
it. Okay. Even in the frigid cold in Vermont.
Even in the frigid cold. I will tell you that last winter, I had one walker that came every single time. He's 89 years old.
Oh, I love that.
89 years old. I was like, I couldn't believe it. So me, I spent 20 years of my life living in Florida, and then I recently moved back to Vermont. So it kept me going all winter because I was like, huh, Stuart's gonna be there. I will be there. So it was
Good.
really great. But
Good.
89, pretty
That's
impressive.
incredible. Well, I
Yes.
hope he comes back again this winter.
So do
Um,
I. I really do.
yeah. What's the biggest challenge that you're facing in your business right now?
Getting the word out, educating, like I said, that it is a big thing because I find myself educating my colleagues a lot of the time about the power
Mm.
of lifestyle medicine because I do think, you know, yeah, technology is amazing, new medications are amazing, and definitely we're getting more and more advanced as far as that goes. But it makes it hard to appreciate the basics.
Mm.
And that is hard. I find a lot of time spent educating, like this really works. If
Yeah.
we focus on these basic principles, even if you can't avoid medication altogether, maybe you can have lower medication. Maybe the
Mhm.
outcome overall will be better. So that is the hardest thing, is the barrier is just getting the word out and really proving that is effective. I mean, there are hundreds of years of data, that demonstrate the power of lifestyle medicine and plant-forward nutrition,
Mhm.
but it's not as mainstream because it's not supported by, you know, pharmacology, pharmacy, pharmaceutical companies, sorry.
Yeah.
And yeah, it's just not as popular.
Yeah. There aren't
We
too
need
many
a spinach
commercials.
lobby.
Yeah. There aren't too many commercials on at night in between a ball game or between a show that say, "Hey, go walk with your doc." There aren't too many
Right,
commercials that talk about that.
right.
Yeah. Yeah.
Yeah.
How do you feel AI is affecting, whether it's from the patient side about what they're doing on their own or how it helps you in your practice if you utilize it?
I mean, it helps me with like, doing, literature searches and things like that. Sometimes I use it for editing and things like that. Can be really, it's kind of good to have like an assistant. So it's very cool
Mhm.
that way. I do find that the patients come, they, a lot of times I work in urgent care as well, and often they'll come with data that they've, gotten from AI. So
Mhm.
it can be a little challenging sometimes because, AI is great, but you need that, the filter. You need
Yeah.
yeah,
Yeah.
the
Absolutely.
expertise really to sort through it. I feel like people feel like they're experts now because of the AI, but it's not necessarily.
It used to be Dr. Google, and now it's Dr. Chat and
Right,
Dr. Claude or whatever people use. So it's good
right,
that
right,
the beauty of that is they're becoming more proactive in looking for options for themselves because they know something's wrong. They
right.
just aren't sure how to go about it. They're a little bit, afraid, and from misconceptions that are out there too. So it's helpful, but then you have to sometimes step them off of the ledge and say, okay, there's a better approach that we can take with this.
Right.
Yeah.
That's true.
Yeah.
Absolutely.
Yeah.
It's
So I
true.
would love for you to share a success story of a patient that's come in to see you that, depending on what they're, maybe they were seeing somebody in typical traditional medicine, or, they did go to ChatGPT and asked a question, they found you. Like, how have you changed their life?
Well, I have one patient from I guess it's earlier in the year, is a woman that has had diabetes for years, had been on metformin for a long time, and really had struggled, was increasing medication. And she, worked with me in my program. My program, definitely I recommend a little different than what is typically recommended for diabetes. Normally the low carbohydrate diet is really popular and recommended. And she, did this program, and about 6 weeks in, she was like, I'm feeling really much more energetic. I've lost weight, and I'm not counting calories. I am eating foods that I've been told not to eat for years, and I'm seeing results. And then she later, after she finished the program, she let me know that she's off metformin now. So that
Really?
was great. Yeah, after many years. I mean, she'd been on it for years, so it was very reassuring. And I think she felt amazing. She was really, um, empowered, really, because
That's,
yeah,
that's the best part of the practice, when you get the success of like 100% success. I don't know how many practitioners have had that, but those keep you going on the days that get hard, when they
absolutely,
tell you how they're changing, how they're feeling, how it affects their families. So thank you for sharing that. I appreciate it. So
absolutely.
kind of on that success standpoint, what does success look like for you in your practice?
What does my practice
Yeah.
success look
So
like?
from your standpoint, like, what does success look like if whether it's myself coming to see you pre-diabetic, or whether it's someone else, like, what does that success look like in your practice? How do you see that where you're improving your patient results?
Well, success to me is the patient being happy,
Joy.
really, really, feeling good about the decision and choices that they're making and seeing results. That's the best thing, when they not only maybe numbers wise or medication wise are able to reverse or come off medication, but when they really recognize that, number one, I'm doing this and it's not a struggle as much as a struggle as maybe, in the beginning it's a struggle, but when they make that switch and it's like that transformation,
Yeah.
and it's like they become this new person and they have these new tools and they are reaping the benefits, and that's really the win. And then even the best is, I have another patient story, a
Please.
woman that was doing the program. Her husband has lost 20 pounds. He's not even doing the program, and he was very skeptical. But because he's following the same, basically they spend obviously they spend all their time together. So he's eating the way she is, he's exercising with her, he's doing all the things that she's doing and
Yeah.
reaping the benefits. So that's that ripple effect in real time.
Absolutely. Absolutely. I'm
Yeah.
sure he's very appreciative. Hopefully he tells her to tell you he's appreciative of it. Yeah. Yeah.
Yeah. He hasn't told me yet, but I'm waiting.
You'll get there. You'll get there. Men are a little bit stubborn, unfortunately.
Yeah.
So, as a lifestyle medicine physician, with your background and the history that you have, what do you feel that you do better than anybody else in lifestyle medicine?
I think, what do I do better? I mean, I love I told you I love to cook, I love to eat, I love to make recipes. So I think that part of it, like finding that joy in eating and really being able to mix the the healthy eating with the flavor and joy, I think that's my special passion. It's my passion, but I think it's also something that I'm able to do pretty well.
Okay.
So
But I want you to brag a little bit about yourself. If there are people that would come in to see you that are, type 2 diabetic, pre-diabetic, like, what do you feel that you offer them that others can't?
I think I offer them a different perspective. I mean, I think that's the biggest thing, and that's what people tell me, is that they finally feel like they have control. They feel heard. I think that's a big thing, especially for women in midlife. They often are left out of the discussion and are not treated. I don't know. I don't want to be negative, but really, they don't feel heard. I've heard that
Yeah.
multiple times, and I think that's
So have
that's
I.
big.
I've heard that on this podcast from many providers. Yeah. Yeah.
So
So in your practice, What's the vision that you want to see in the next 5 or more years?
In my practice, I want my practice to be thriving, and I want to create a movement, a joyful wellness movement. That's really what I'm about. I want lifestyle medicine to really be mainstream. So in 5 years, I have a lot.
Yeah, you got
But I
more
also
work.
want, the to realize that joy and wellness go together. Joy and health go together, and that they're not separate. They shouldn't be separate, and that when we talk about helping our patients, that we really need to put that in the forefront. Because I'll just say that a lot of times and I've done it myself in the past, calling a patient non-compliant, or being disappointed or unhappy with the patient because they're not doing what we think they should be doing. But it should be a partnership. And I think if we understand what our patients' needs are, what our patients' likes are, what our patients' joys are, then we can really create a
Yeah,
positive effect and really create change. So
love it. So did you say joyful wellness? Is that how you
joyful
point?
wellness. Yes.
Joyful wellness, a joyful wellness revolution. I love that. That's fantastic. Well, I hope you do achieve it. That's for sure.
Thank you.
So, as we wrap up here, I'll share all of your links in the descriptions that we have, where we share it across all the social platforms. But what I want to know, if somebody's interested in what you had to say, they want to learn more about you or how you practice, whether it's an individual or a practitioner that wants to ask you some questions, how do you suggest they reach out and get a hold of you?
They can go directly to my website, which is healthylivingwithdrjen.com, and book a free discovery call. I do free discovery calls, so that's the best way to get.
Fantastic. Thank you for sharing that. So, two last questions. Since you are a very well-versed healthcare practitioner, what's one piece of advice that you could give out in a healthy or positive way that could change people's lifestyles?
So this is what I start with all the time. I just say eat more fruits and vegetables, because I think that we're always focused on what we shouldn't be doing. Oh, I shouldn't have this, I shouldn't have that. But really, the most powerful thing that we can do is increase our fruit and vegetable intake. It is life changing. It lowers inflammation, it reduces our risk of cancer, it lowers our risk of type 2 diabetes, lowers our risk of heart disease. So literally, that's it. Eat the rainbow, eat it abundantly. You know,
Yeah, I love that. No one shared that. I love that. So, what's your favorite fruit that you suggest people to have?
berries. Berries are
Berries?
really powerful. I love any kind of berry. It's great because the colors are great for you, those
Hmm.
anthocyanins and antioxidants, but the fiber content is really good. So lots of
Okay.
vitamins and minerals. Berries are the way.
I know what I'll be shopping for this weekend when I go to the.
Great.
And then finally, you've been a wonderful guest on the Prime Health podcast. What is your definition of Prime Health?
My definition of prime health is, I think that's it, joyful wellness. Like, so having the perfect combination of, joy and your wellness journey. So joy and health really go hand in hand. So when you have joy and you're ideally centering the pillars of lifestyle medicine, then that is prime health. You will have prime health.
Yeah. Love you. Thank you for sharing that. Dr. Davis, you've been a wonderful guest. I appreciate it. Again, from our conversations, even before the podcast, what you bring to the table from being the pediatrician and being in the intensive care, and then wanting that transition where you know that people are hurting, they need help. You make a big decision to go into lifestyle medicine, which I'm sure you're very happy that you've done that. And, there's so much of an impact that you're making on individuals, families, and probably communities as well. So I always ask that people share this, and it's so important. I emphasize this because there's somebody that when they're listening or watching this, somebody can benefit from what Dr. Davis had to say. Please share it with that person. Share it with as many as you can, but share it with that person because it's so important that what she had to say today or doing a discovery call can change that person's life. So take the time, share it. There's people that need to hear that. I'd love for you to subscribe to the Prime Health Podcast wherever you are. So as we wrap this up, until next time, remember that true wellness is a journey that we are all on together. And joyful wellness, as Dr. Davis puts it, is a great one to do. So whether you're taking charge of your own health or guiding others on theirs, every step forward matters. So I always say, please stay committed to your Prime Health journey. Again, Dr. Davis, thank you so very much for being a guest on the Prime Health Podcast.
Thank you so much for having me. This has been a joy.